Good evening, everyone. Today I will be presenting on a sleep disorder that affects many people worldwide, insomnia. Insomnia is a common sleep disorder that can lead to difficulty falling asleep, staying asleep, or both. It can affect your energy level, mood, and overall quality of life. In this presentation, we will explore the causes, symptoms, and treatment options for insomnia. Now, what are the causes? Insomnia can have various causes, including stress, anxiety, depression, medical conditions, medications, and unhealthy sleep habits. Stressful events such as work pressure, financial issues, or relationship problems can cause insomnia. Similarly, anxiety and depression can also disrupt sleep patterns. Medical conditions such as chronic pain, breathing difficulties, or gastrointestinal problems can also lead to insomnia. Certain medications such as antidepressants, corticosteroids, and stimulants can interfere with sleep. Lastly, unhealthy sleep habits such as irregular sleep schedules, excessive caffeine consumption, and lack of exercise can contribute to insomnia. The symptoms of insomnia include difficulty falling asleep, waking up too early, waking up frequently during the night, feeling tired upon waking up, feeling sleepy during the day, and difficulty concentrating or remembering things. These symptoms can affect your energy level, mood, and overall quality of life. The treatment for insomnia depends on the underlying cause. If stress or anxiety is the cause, relaxation techniques such as deep breathing, meditation, or yoga can be helpful. Cognitive behavioral therapy, which involves identifying and changing negative thought patterns and behaviors that contribute to insomnia, can also be effective. Medical conditions that contribute to insomnia can be treated with appropriate medication or lifestyle changes. If medication is the cause of insomnia, your doctor may adjust the dosage or switch to different medication. Lastly, adopting healthy sleep habits such as maintaining a regular sleep schedule, avoiding caffeine and alcohol, and exercising regularly can improve sleep quality. In this slide, another category of sleep disorder is mentioned that occurs due to the abnormal circadian rhythm that normally maintains the physiology of sleep. Circadian rhythm is like an internal clock that tells our body when to feel awake and when to feel sleepy over a 24-hour period. It helps us sleep at night and stay awake during the day, influenced by natural light and darkness in our environment. Circadian rhythm sleep disorders are a group of conditions that occur when a person's internal biological clock, which regulates the 24-hour cycle of sleep and wakefulness, is out of sync with the external environment. This misalignment can lead to problems with falling asleep, staying asleep, or waking up at desired times. Common types of these disorders include delayed sleep phase syndrome, where individuals have difficulty falling asleep until late at night and struggle to wake up in time for work or school. Advanced sleep phase syndrome, characterized by falling asleep early in the evening and waking up very early in the morning. And shift work disorder, affecting those who work non traditional hours and have trouble adjusting their sleep patterns accordingly. Treatment often involves behavioral strategies, light therapy, and in some cases, medication to help realign the body's internal clock with the outside world, improving sleep quality and overall functioning. So, now in conclusion, we can say that insomnia is a common sleep disorder that can affect your energy level, mood, and overall quality of life. It can have various causes, including stress, anxiety, depression, medical conditions, medications, and unhealthy sleep habits. The symptoms of insomnia can also vary and affect your daily routine. Treatment for insomnia depends on the underlying cause and it's essential to identify and address the root cause of insomnia to improve sleep quality. Adopting healthy sleep habits and seeking appropriate treatment can help manage insomnia and improve overall quality of life. Thank you for listening, and if you like the video, make sure to drop a like. Let me know if you have any suggestions in the comments below.